Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans.
Welcome to another episode of the Healthy Chicago podcast. My name is Stephaney Harris, and I am the Victim Services Lead at the Community Safety Coordination Center, which sits under the Chicago Department of Public Health. Joining our conversation today, I am thrilled to introduce JaShawn Hill, Executive Director of Chicago Survivors. JaShawn, I'll let you introduce yourself, talk a little bit about you and the work of Chicago Survivors.
Absolutely. And thank you for having me on this podcast today. I am really excited to just see the conversation that's going to come from our dialogue together. Chicago Survivors is a huge part of my narrative because a survivor I am myself, recognizing the importance of having an organization that is victim service, survivor-centered, responding in the city of Chicago to all families who've been impacted by homicide has been truly vital as someone who's a leader in community-based organizing. And so when you asked that we would share this space together, I knew, Stephanie, that our communities need to know about programs like Chicago Survivors who are free and reaching so many.
Absolutely. Awesome. Amazing. Really excited to get into this conversation with you today. Before we begin, just want to inform people that, we are going to be talking about topics around victim services, support to survivors who have experienced community violence. Know that may be a sensitive topic for some. So just really encourage anyone, as it resonates with you, to just check in, take breaths as needed, and do what's needed for your own self-care to honor yourself. Okay, so victim services, as I like to call it, survivor supports.
Yeah.
Right. So in your opinion, and just regarding the work of Chicago Survivors, what is victim services, and what are some of the types of supports that Chicago Survivors provides for survivors of crime?
Well, victim services for me is a response to community who have been harmed, who have been, products of, violence, community-based maltreatment, maladaptive responses in our community. And for many years, Stephanie, as we know, there was not a lot of response efforts shaped around victims, right, who had been harmed in communities. It was almost as if it was there and we knew it was there, but there was no unique, specialized, specific response and services for that. And so when we think about Chicago Survivors and what we do, we're survivor-centered. So every facet of our program is speaking to the healing journey and trajectory of a survivor and someone who has been a victim of crime, a victim of harm in communities, knowingly, sometimes unknowingly. Many of our survivors didn't even know they were survivors. They thought because their loved one was the victim of a homicide that they were the survivor, right? They would have been the person needing the care. But no, we educate and let them know, no, you are a survivor. You are a victim. You lost someone traumatically.
Yes, absolutely. And you touched on something really important there around people not really knowing what it is. And now there are intentional efforts, intentional investments specifically to support survivors of violent crime. Not saying that community folks have wrapped their arms, organizations have always wrapped their arms around community, right? Yes. But for there to be a particular and a very specific investment for victim services, for survivor supports, just in your experience, how would you say that has changed in terms of what it was before to where it is now, especially in the context of working with the city to do this work?
Absolutely. The fact that the survivor voice is what is shaping how we are responding is epic, right? I think that being someone who is just operating a program based on just, theory, and observation is totally different from getting the voice of the survivors. And I think that that is something unique and imperative that the city did these past few years, is really invite the survivors to the table. And when we think about Chicago Survivors, we are survivor-led. As I open, I am a survivor. I lost my brother to violence in this city in 2008. And here we are going on our 10th year of responding citywide with the voice of the survivor, the needs of the survivor at the center of how we respond and shape the services. It's specific, and it is really shaped around what their needs have been based on what they have told us and showed us over time.
Yes, yes, absolutely. So Chicago Survivors, you all sit in a unique space relative to other organizations in this work across the city in that you all serve survivors of homicide citywide, whereas most other organizations, they focus on either one or more specific neighborhoods or community areas where they're doing responding to those incidents and providing supports to families. Just wanted to take some time to talk a little bit more about your organization and the work of Chicago Survivors. And what would you say makes your organization unique in that right?
And, you've already unfolded a piece of it. Mm-hmm. And the fact is that we do homicide response. I'm asked at parties sometimes, like, what you do for a living? I'm like, do you really want to know what I do? Right? That's a loaded question. You sit down. Because we're about to talk about something like heavy and serious that's, responding not just to trauma, but complicated grief. Mm-hmm. Right? Mm-hmm. And so we're talking about family systems who many times have not just lost one person in their family system, but it's almost like a generational touch that has happened when it relates to homicide, because we know most households who've had one touch has had at least 3 to 4 touches when it relates to a traumatic death. And so when Chicago Survivors came on the scene, we recognized that survivors just didn't need that brief touch in treatment. We needed wraparound care. We needed the trauma-informed services, but also grief care that would support families in their healing. Yes. Because if they don't have a pathway to healing, one that is laid before them, it'll look like a phone call, can you help me? And you asking me, well, what can I do for you? No, that's why I'm calling you. Mm-hmm. And so when they call Chicago Survivors, we're saying, hey, we have our crisis response team that was right there in the initiating services with crisis support, helping with their basic needs, the funeral planning component, and then seeing is your family available for family support? Returning to work, is there children who are in the home? We provide the clinical services care because we recognize that the brain of a child who's exposed to a traumatic death is going to miss milestones and gaps in their journey if we don't approach it with specific targeted healing practices, right? And then they need a community. And so that community of survivors is what we have uniquely as well. Peer-to-peer support led, again, their voice guiding what we do. And they spoke, a few years ago and said we would like a specific camp, even for our kids, post-COVID, to come together, because this grief and being in the home was just a lot, and we created that for them. And that's flourishing, because that's the survivor's voice, and they bring it to us. And, programs that the city supports us with allows us to do that, removing the barriers, getting kids to safety during the summer while healing at the same time, and going to court with them. Yes. Because somebody will be brought to justice, even though we know the rates may be low. But what about those families who do need that support and don't know that they have support, and we're there in the courts with them? Cases could take up to 4 years, right? Yes. And so every time they go in that courtroom, and there's a continuance, or there's some new evidence, and they don't get to use their voice, who's helping them to be, calm, regulated, understand the system of judicial practices? Chicago Survivors is there. Our criminal justice advocate is there. So all of those facets help us to address the survivor and the survivor's whole system that is connected to those who now remain after the loved one has been taken, because they now lost. We all, people say sorry for your loss. Our family say, no, my loved one was murdered. My loved one was taken, right? And so we're here in the midst of that. That's why I said, ask me what we do for a living. You want me to talk about? You want to hear this language?
Right. Are you sure you're ready for this conversation? Right? Are you sitting down? For sure. Yeah. For sure. And we absolutely just appreciate all of the work that you and Chicago Survivors does for survivors of homicides throughout this city. And I like to think of victim advocates as guides. They really are guides. They are helping families to navigate through various systems, during what is considered to be the most traumatic time in their lives. And it's a very multi-layered, multifaceted, when you talk about that complicated grief. It's just so many just different nuances and things to unpack there. And so it's a very just dynamic approach that you all as Chicago Survivors takes. I want to talk a little bit about the approach with survivors and maybe best practices, language, do's and don'ts, for instance, when it comes to, especially in the immediate aftermath, when there's a response, the scenes might be chaotic. There's a lot of obviously like emotions, very traumatic. And so what are some of the things that you would say in terms of best practices on how to approach or language to use with survivors? I think you had mentioned one around sorry for your loss and things like that. What would be some best practices that you would highlight here?
Right off the top, who we bring into the space to respond to the survivor community matters, because I can say have a compassionate response effort, right? But without the particular skill set and the trainings like that we are able to provide, even the city is now providing, that is just language. And so what does compassionate response look like? It means being competent in what the survivor experience looks like to the best of your ability, being exposed to what that could mean, the most tragic day of their lives, right? And being able to not necessarily put yourself in their shoes, but be aware of it. Open yourself up to what that means, how the impact of a traumatic death like that could affect someone's emotions, right? And how a grieving person and their response is individual. It is not what you saw on TV, perhaps, right? And some people, just because they go quiet doesn't mean that they're okay and that they not, but being able to be present and compassionate means that I come to the level of the person who is grieving, right?
Yes.
And anything they say to me is not personal. So I want to be aware of what I'm sharing. Keep it in ways like you will never understand what they're going through, but you can try and empathize. You can try to be aware. You can aim to understand what it means to grieve after tragedy, and you still don't know enough. And being okay with that, right?
Yes.
And being there to learn from them as we are preparing our staff and our community-based organizers, our outreach teams and everybody to really be there and compassionate. Even someone with lived experience, I don't say that I know what it feels like, right? Because yours is individual. It is no cookie cutter grief expression. Like just about now, she's about to yell. No, that is not. I can't anticipate that, right? It is individual. So being able to just share certain language like that, like no language is okay. Not saying anything sometimes, and being present and being able to say, you know what, this has got to be the hardest thing. And I am here for you. Right? I am present for you. And if they tell you, I don't need you, give them some distance. Give them some distance, because it's not about you.
It's not about you.
It's not about you.
Absolutely.
It's about that person they love. And try and honor them. I think I would close with that, is learning to get to know the person who they are grieving. Right? If they can share anything about it, and listening to, that was my son, that was my baby, and whoever else is around who's a support, listen to them and connect with that so that you can show compassion and have empathy, because nobody deserves to be shot down in the middle. No one deserves to die in violence like that. I don't care, what the narrative may portray, because that's somebody's son, that's somebody's mother, that's somebody's daughter. Somebody loved them.
Yes.
And it, but for the grace of God, it could have been any one of us, right? So those are just a few, right?
Yeah.
I'd get off my soapbox just a minute. I was going there.
I love it. Stay on the soapbox. We're going to keep on this soapbox.
Yes, yeah.
You said so many key things there. One of the first things I heard, just put my social worker hat on. I know you can relate social work to social workers. Meet people where they are.
Yes.
Is so critical and so very important. And just you hit on training, and you also hit on in terms of language. I think you use one of the many examples you use is "I understand," and that this is so timely because as you know, we're hosting our pilot training for victim advocates, and I'll talk a little bit more about that. And Chicago Survivors is on that call. We're literally having a virtual call today, and one of your staff pointed that out as something to maybe refrain from saying because you don't understand. So the fact that you said that is so in resonance with literally something that just happened in training. So kudos to you and your team for the amazing training, but also just wanted to highlight that because it's really, really, really important.
It is important because we think we're saying something that's going to support, right? So no one's tried to harm. And if you've been harmed, a lot of times we've been taught in society the way to connect is to share stories, which can be healing at some point. But at that moment in time, telling a person that, you could trigger them and you can be like, oh my God, I only came to help.
Yes.
And guess what? You still was in your own way.
Yes.
Right?
Yes.
But we want you to be more informed, more educated, so then we don't have to make those little booby traps.
Yes, definitely. Okay. Yes. I do want to circle back to training, but before we do that, just wanted to ask around what would you say, because a lot of times when people are victimized through violence, for many, this is not something that's just like a regular everyday thing. It's like, oh, I'm used to this and I know what to do. It's very scary. And then just, being honest, there's a mistrust of systems, right, that just exists, right? Yes. But what would you say to the survivor who may have been impacted by crime and is a little bit hesitant to engage in services because maybe that mistrust of systems or some fears that may exist?
Yeah, I would say be open to piecemeal approaches, which means you don't have to do it all, because now our city is responding with a robust approach to how people can heal after being exposed to a violent act, right? And being survivors and victims of crime. So approaching it in a way that whatever lands for you, be open to that. And number two, the folks who are responding to us now have been tried and tested over time. And it is more of the people who look like you and who are part of the journey that you've experienced with lived experiences who are informing the systems that may have harmed us now. And so will this take time to get in the blood? Yeah. But if we talk to each other, if you listen to, podcasts like this and discussions like this, what you're going to find is that there are some real efforts to have systems coordinating with survivors, with the victims, and using their experiences to shape policies and the resources in a way that is distinctively and specifically for you. And it's an intentional approach. So, and being open to piecemeal. I know we have all these forms and things like that. It's like, who's getting paid for that? Who's getting credit for that? All of those things, right? Yes, we have to record information and data, but I tell my staff all the time, meet them where they are and say, if today ain't the day, I'll try tomorrow. I'll try you tomorrow. Yes. And they can find that with us now. We're more consistent. We're more present. We're on purpose. We're on purpose now. Yes. Right? It's very intentional.
Yes.
And so I think that's one of the greatest things we've been able to do and improve, and being open to that. Don't have to do it all. Everything ain't for everybody. But it is something I believe you'll find for you, because we did it with you in mind this time.
Yes, absolutely. So you definitely highlighted a lot of benefits that a survivor, families, loved ones can receive during a tragic incident like an incident of violence. Let's talk about I think violence impacts the individual. It also impacts on a community level. Let's talk a little bit more about your take on the community impact of victim services supporting survivors of violence, and how does it impact the community at large?
Wow. I would say, the violence has impacted us gravely. That's why our trust is low, right?
Yes.
Our PTSD is high.
Yes.
Right? So we are now trying to infuse these interventions that we're talking about here, in our trauma-informed and grief-informed responses to community, ensuring that people get like a uniform care approach, right? So you're not going to call your neighbor and they get a different experience, right? To the best of our ability. And you didn't know that you could have, crisis funds or critical response care, right? It will become more of not an exception, but an expectation.
Yes.
Right? That this is what we're going to get uniformly across the board. And, communities are now healing more and speaking about it more. I know firsthand because they follow me even in places that I'm like, this ain't the Chicago Survivors event. They said, but you had it in the newsletter, right? Which let me know that they trust our word about even who we connect with, right? Because it's mattering now. They see more and more that with the leaders we are choosing, the organizations that the city is choosing, to fund and to create space for this work, is now, they're creditable. They're doing what they say they're going to do. And the moms, oh my goodness, they're like, this, JaShawn, there's no programs like this. I said, because there was no programs like this when I was coming up either. You had to suffer in silence. You had to hold it together, right? That's what they said. But what's the truth? Like, you can't hold it together. And that's why the community began to malfunction, until we are now doing what we're doing today. So I hope, that's my answer.
All of your answers have been amazing. Thank you so much. Yes, absolutely. So I want to pivot really quickly back to, you touched on training and just really incredibly grateful to you, Chicago Survivors, with supporting. Part of my role is I support the Victims and Survivors pillar as part of the People's Plan for Community Safety under this administration. And what we multiple stakeholders, community stakeholders have decided was to help to standardize training, have a citywide standardized training for every victim advocate in the city of Chicago, from large organizations, small organizations, and everything in between, to be able to get trauma-informed training. And you and so many others in the community are a part of that collective effort. We have survivors of violence who are giving us feedback. So we're going through a victim advocate training pilot right now.
Yes.
But really talking about training and why it is so important for victim advocates just across the city to receive training and how that impacts the larger ecosystem of survivors. You can just talk a little bit more about that.
I mean, I'm so excited about it. I'm just going to say that, because I recognize this is my 9th year as Chicago Survivors, right? When I came to that organization, family support specialists recognized they didn't have a youth program that clinically responded with certain kind of evidence-based practices. And now the executive director developed with director of clinical services. And a lot of that growth came through training and bringing in staff members to inform them on best practice of how to help survivors heal, right? We were a lot of people who wanted to do good. Man, we wanted to do good.
Yes.
But what was in the tool belt? My story? A whole bunch of hugs. I mean, hugs is good. They good. But what happens after you done hugging me and you leave me? That you give me resources, that you give me tools, that you have a toolkit where you able to really know, like, I can measure impact in ways that says reduction of PTSD for real, right? Even after I've been exposed to more trauma, because I'm going to, because my neighborhood is still healing, it's still convalescing, right? I'm still going to go back into a school with traumatized and re-traumatized peers. Can we really say that we had those tools? I don't know that we could 5, 6, 7, 8 years ago, right? Unless you had like a license in training. I got a Loyola degree. So when they brought me in, that's why all my lights went up. I was like, oh my God, this is a pilot program. This is right. So, but I had the education. I had the training. And I saw that my peers and my colleagues who wanted to do so much didn't have the curriculum and the way that we could do it. And today we're in a different space. We're in a different space, and I'm talking about a mighty army and a mighty movement that's about to happen in victim services. I know we got to go, right? But I'm just saying that's on the way because of the training, because of the uniformity, because we have something that we can see is evidence-based and can produce on it. So
Absolutely. Absolutely. Thank you so much. And you hit on something really, really important. You said uniformity. So one of the things that, we often like to say, and I know you've said this as well, is we're better together.
Yes.
So in the context of coordination with among other victim services teams, among other people who are, especially folks who are responding to the same incidents of violence and needing to work together and communicate in real time, let's touch just really briefly about how important that coordination is and ultimately how that can impact services to survivors in a trauma-informed way.
Oh my God, it's vital because I'm the expert in the lane that I'm the expert in the lane, right? And my other sister partner organizations like Bill, UCAN, and the others who are doing the work, who are out here, right? Breakthrough, doing like they are who they are in their lane, and we are neighbors and we are friends, and we should know what each other is doing. And when we do that, we can delegate and we can hit more. Right?
Yes.
And it continues to be a ripple effect. And then the community begins to know that, right? And they almost become advocates. Like, girl, no, you in what zip code? See, you supposed to be at Breakthrough. They can't
right
over there, right? Because that's what the power coordination does.
Yes.
It doesn't say, oh, we are the ones who do this. I think we have come together in a way to say, let's delegate this because it's so much that has been harmed in the process of trying to do good that now we have refused to let doing good get in the way of us being great.
Yes.
Right?
That's
and I really see that, and I value that, and this is an exciting time in victim services in the city of Chicago.
Absolutely is.
So.
Absolutely is. This has been an amazing conversation. Just a huge thank you to you again. Before we wrap, if you can tell people how they can get in touch with Chicago survivors, learn more about the work, support if that's something that resonates.
Always need support.
Yes.
Because we always want to be able to do the best and the most for the families we serve. But they can follow us on all our social media handles with Chicago Survivors, Facebook, Instagram. I know it ain't Twitter no more. My son keep correcting me. X, right? It's all of that, LinkedIn, the whole 9 yards. But right now is holiday season. And so we're going to have some Coke giveaways and some gathering together for survivors in the community on December the 21st. So again, just follow us. And if you want to donate, www.chicagosurvivors.org. Click donations, real simple. And you could pick a campaign. If you like the kids, you want to make sure they got wellness kids going more into school.
Love it.
Pick your campaign that you really care about, and we can go and help. So
amazing. Thanks so much, JaShawn. Thank you so much. Really appreciate you. And that concludes our podcast for today. This has been another episode of the Healthy Chicago podcast. We'll see you next time. Thanks.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.